This one looks like it has two parts to it. I know this question may seem dumb to professionals and knowledgeable individuals. Are fillings truly a necessary treatment for tooth decays? I have a lot of cavities, and I'm wondering if keeping a good hygiene can stop cavities. Brush my teeth twice daily and floss every night. Is this enough to stop existing cavities?
So we will come to the second part later. So the first part of this question is, if you have some cavities starting, so can you really avoid going to the dentist and brushing and flossing? Can that really help? Again, the answer is it depends on the cavity. And I did not know that this question is coming up later, but I already answered this question talking about the second molar and the third molar. So for example, on that kid that I was talking about, who came in earlier today, so the second molar has a small cavity in the back because the third molar is sitting right there. So now the source of the problem is the second molar, the third molar sitting here. Now that we are going to remove the third molar, and then he has a very, very small, tiny cavity starting right on the surface right here. So possibly by removing the source of the problem, which is the third molar, now is he going to get some remineralization of those cavities just by properly utilizing the proper toothpaste and then properly using your toothbrush in the back and all of that? Can that happen? Yes, it can happen as long as it's a very, very tiny cavity. If a cavity is slightly bigger, then I don't think it is going to get better by just properly brushing and flossing alone. And a lot of times what we normally see is if the cavity is between the two teeth, for example, when you have the two back teeth like this, the cavity happens in between, and if it is slightly under, there is no way you will be able to use that fluoride right underneath here. If it is on the top of the surface, for example, just like this person is asking, yes, by properly applying more fluoride, properly taking good care of your teeth, and you may be able to get away by not having to do any fillings or anything. But if it is in between the teeth when locked in like this, the chances of you taking care of it without going to the dentist very unlikely. And then a lot of times what we normally see is because the cavity is in between the teeth like this, you can't even see from the top. You can only see that with special x-rays that you can take at your dentist. So even the dentist sometimes get a surprise. The teeth look great, but underneath, once you start taking the x-rays, then you see a big cavity. And you may not be even hurting until it becomes kind of severe. So the answer to that question is, can you get away by not getting any fillings? The answer is possibly yes. It depends on where the cavity is. If you do have a tendency for cavities, before it gets even worse, make sure that you follow the techniques we talked about, using the proper toothpaste, brushing and flossing, avoiding the soda, avoiding the sugary drinks, and using a water pick and any other gadgets. And whenever you're at your dentist, talk to your hygienist who may be doing your cleanings and ask them whether you're using all these tools properly. So variety of techniques and using the tools properly, using the right gadgets, and seeing the dentist on a regular basis can help avoid the cavities to be treated.